Hello, my name is Lindsay Flanagan and I am an adult geriatric acute care NP student at NKU. Today's date is 7/14 and I'll be dictating a transfer note for the infectious disease team. The patient's initials and date of birth is JJ 12/15 of 1981. The date of his admission 7/1 of 22. Date of transfer is 7/14 of 22. This is admitting diagnosis of this patient as a suspected left foot infection. The discharge diagnosis is MSSA bacteremia secondary to osteomyelitis of the left foot fifth metatarsal. Secondary diagnoses are postoperative pain, type 2 diabetes, and history of gastroparesis. The procedures that this patient underwent was on 7/2 of 22. There's an IND and amputation of the fifth metatarsal on the left foot. Findings from this procedure confirmed osteomyelitis. Purulent yellow fluid was drained. Sutures will be removed in 2 weeks. Post-op given no complications. On 7/3 of 22, the patient also had a double lumen peripherally inserted central catheter placed for long-term antibiotic therapy. Consultations included the hospitalist for management of total care while the patient is inpatient. Infectious disease was consulted for the management of bacteremia and osteomyelitis, and podiatry was consulted for amputation of the fifth metatarsal secondary to the osteomyelitis. History of present illness is that JJ is a 40-year-old white female who presented from jail on 7/1 of 22 for further evaluation of a left foot infection that was initially started 4 months ago as a dry piece of skin and callus to the lateral portion of the foot, eventually becoming a non-healing ulcer. The patient was previously hospitalized in April, having wound cultures positive for MRSA, S. aureus, and S. epidermis, receiving a course of antibiotic therapy without follow-up outpatient. See full H&P for details. The hospital course, with her current admission, the patient did have blood culture sent, which have started to grow MSSA. Also, she underwent radiographic imaging of the left foot that showed osteomyelitis to the left metatarsal head. Podiatry decided to amputate the fifth metatarsal on the left foot on 7/2 of 22, along with an IND. PICC line was in place for long-term antibiotic therapy. She was transferred to the orthopedic floor for postoperative management. Patient is to remain inpatient for IV antibiotic therapy with cefazolin 1 gram 3 times daily for 2 weeks from the last negative blood culture, which was on 7/3. So she can stop antibiotic therapy on 7/16, potentially discharging on 7/17. Unfortunately, this patient does not qualify to go home to complete her IV antibiotic therapy since she is an inmate of the county jail. Therefore, her only option is to remain inpatient to finish out her course of antibiotic therapy. The patient will be transferring to the unit specialized in long-term antibiotic therapy on the second floor. Medications that this patient is currently taking is Zofran, and this is antiemetic therapy to help with her gastroparesis. She's on Fluorastor as a probiotic for strengthening the digestive balance and support. Imodium for her loose stools. She's on Lovenox for DVT prophylaxis while inpatient. Cefazolin 1 gram 3 times daily for MSSA antibiotic therapy. She has Tylenol PRN for pain and fevers. Percocet Q4 hours for analgesia for breakthrough pain untreated by the Tylenol. She also has Protonix prescribed for prevention of stomach ulcers while inpatient. She has sliding scale insulin, the low dose sliding scale for type 2 diabetes, insulin therapy, management for elevated blood glucose. She's also on Phenergan, also to help with her gastroparesis, and Benadryl used as a sleep aid for this patient. There are no pending studies for this patient. Patient is at baseline functioning status. She is alert and oriented to person, place, time, and situation. She is able to ambulate independently with somewhat of a limp gait due to pain from her amputation. She is able to perform all activities of daily living. It is recommended that this patient follow up with podiatry outpatient for continued management and evaluation of the foot ulcer and to ensure postoperatively that the patient's incisional site heals appropriately. Additionally, the patient should follow up with their primary care provider outpatient within 3 days of discharge in order to ensure that the patient is following outpatient prescribed therapies correctly. The patient is going to the second floor unit specialized in long-term antibiotic therapy. The patient will be under the care of the hospitalist and infectious disease primarily. Podiatry will follow peripherally after the removal of the stitches.